Well, Jim, I love the Joint Legacy Viewer. It's something that we have in common with DoD. Back in October of 2013, we had about 500 users. We have, we have right now. So as of last month, we had 41,000 logins just on the VA side, and 141,000 records looked at. And the reason Joint Legacy Viewer is important is for that continuity of care, especially in the scene where veterans come across from their active service to the VA. And we don't have a lot of data on the VA side, but there's a lot of data on the military side, or in cases where veterans are being seen at different places. So we have had for almost 2 decades information on from the military health system, or from the 130 different VA Vista instances that was available. But it was almost like, say, Mark's information was in a bunch of different drawers. Mark Googe at St. Louis VA Medical Center, Mark Googe in the military health system, Mark Googe at the Miami health system. Now, all of that information, veteran-centric information, is on Mark Googe, is in a single drawer, all of the labs, regardless of venue. And the proof is in the pudding, with going from 500 users about 2 years ago to 20,000 regular users monthly, but really over 125,000 people on the VA side alone being able to access this system and see this information, which they can act on for better continuity of care, more efficiency, no repeated tests, because if they've seen it in someplace else, and also more efficiency, because if you can see that, access is improved because you can get through and get the gestalt picture of the patient's situation and make decisions more quickly than if you have to hunt around for information.
Right. So do I have this right? Does this mean if someone goes from the DoD and becomes a veteran, that the health information is able to go with them?
We can see that in the Joint Legacy Viewer easily.
I mean, that's been a big issue for a long, long time, and people have been trying to solve that problem for a long, long time. So that's I'm sure that makes a huge difference in the life of a veteran, right?
We've made tremendous progress in the past couple of years, and we're expanding that now to private sector care providers with agreements, so we can see that, since a lot of care is taking place in the private sector for veterans and for military.
Excellent.